Hi everyone, welcome back to Med-Surg Mentor. Today let's review a topic from respiratory system, that is bronchiectasis. This video would be helpful for the student nurses and PSC aspirants for their quick understanding about the condition bronchiectasis. Let's get started. Definition of bronchiectasis. It is a condition where the bronchial tubes of the lungs are permanently damaged, widened, and thickened, resulting in respiratory insufficiency. Let's see the etiology of bronchiectasis. Common etiological factors are genetic disorders like alpha-1 antitrypsin deficiency, autoimmune diseases such as rheumatoid arthritis, impaired host defense such as HIV and cystic fibrosis, post-lung infection like pneumonia, allergic bronchopulmonary aspergillosis, obstructed airways, chronic aspiration, and malignancy like chronic lymphocytic leukemia. Next is patterns of bronchiectasis. There are mainly three patterns, and they are cylindrical, varicose, and saccular bronchiectasis. Cylindrical bronchiectasis means involved bronchi appear uniformly dilated like a cylinder. But in varicose bronchiectasis, affected bronchi have an irregular or beaded pattern of dilation resembling varicose veins. Saccular bronchiectasis have a ballooned appearance of bronchi at the periphery ending in blind sacs. Pathophysiology of bronchiectasis. Due to etiological factors like lung infection, bronchial wall is damaged, resulting in inflammation. Gradually, the bronchi supporting structures are damaged, resulting in permanent distension and distortion of the bronchial wall. It creates an impaired mucociliary clearance. Due to this, the bronchial tubes are dilated, resulting in excessive exudate draining through the bronchus. It leads to obstruction of bronchi from retention of secretions. Finally, it goes to a stage of inflammatory scarring and fibrosis, leading to segment or lobe collapse. Ultimately, it results in respiratory insufficiency and other fatal complications. Clinical features of bronchiectasis. They are cough, shortness of breath, fatigue, fever and chills, wheezing, chest pain, clubbing, and hemoptysis. Next is diagnostic measures of bronchiectasis. They are physical examination, chest X-ray, pulmonary function test, blood test, immunoglobulin levels such as IgG, IgM, and IgA, sputum culture, genetic testing, CT scan, and bronchoscopy. Complications of bronchiectasis. They include atelectasis, which means collapse of the alveoli, pneumonia, that is the infection of the lung parenchyma, and empyema, that is overproduction of sputum, which causes bronchi to be filled with pus. Now let's move on to the medical management of bronchiectasis. They include oxygen therapy, oral and intravenous antibiotics like macrolides, mucus thinning medications, bronchodilators such as albuterol, expectorants, postural drainage, chest physiotherapy, and breathing and coughing exercises. Next is surgical management of bronchiectasis. There are mainly 4 procedures, and they are segmental resection, lobectomy, pneumonectomy, and lung transplantation. In segmental resection, the affected segment is removed, whereas during lobectomy, the affected lobe, that is a section of the lung, is removed while the healthy parts of the lung remain intact. It can be also done by video-assisted thoracoscopy procedure. In pneumonectomy, one affected lung is removed based on the extent of damage. Fourth procedure is lung transplantation. It is an option for patients whose symptoms are worsening despite of aggressive treatment. In this procedure, diseased lungs are partially or totally replaced by a donor lung. Now let's see some of the preventive measures for bronchiectasis. They include quit smoking and avoid secondhand smoke, maintain a healthy diet, stay hydrated and drink plenty of water, staying up to date on vaccinations, avoid pollutants and chemicals, improve indoor air quality, and exercise more frequently. Nursing diagnosis for patients with bronchiectasis are impaired gas exchange related to ventilation perfusion imbalance, ineffective airway clearance related to increased mucus production, ineffective breathing pattern related to mucus and airway irritants, activity intolerance related to hypoxemia and ineffective breathing pattern, acute pain related to the inflammatory process, knowledge deficit regarding disease condition, and fear and anxiety related to the breathing difficulty. Nursing care of patient with bronchiectasis. Common nursing cares are assess vital signs, oxygen saturation, and arterial blood gas values, encourage smoking cessation, administer bronchodilators and antibiotics as prescribed, perform postural drainage, encourage alternating activity with rest periods, maintain healthy diet, avoid exposure to infection, auscultate breath sounds and watch for complications, ensure hydration, administer supplemental oxygen, and teach breathing exercises. So far, we have seen regarding bronchiectasis. It is a condition in which the bronchi is permanently dilated and thickened. Common causes are autoimmune diseases, genetic factors, lung infections, and allergies. We have also seen pathophysiology, clinical features, diagnostic measures, management, nursing diagnosis, and nursing care. Thank you so much for watching, and you can request me videos anywhere from medical surgical nursing. If you find this video helpful, please like, share, and subscribe. Thank you.